Hello， 大家好，我们又见面了。如果这是你第一次看我的视频，你好，我是 Michelle 施瑶，一名加拿大的注册护士。那么在上个视频中，我们一起了解了如何用英语填写病历表。如果你还没有看过那个视频，请去看看吧。那今天我将分享5个小贴士，帮助你为与医生的预约做准备。So tip number 1.If you know you have difficulty communicating in English, you can ask for an interpreter. So when you're booking an appointment with the receptionist, inform him or her that you'll need an interpreter during the appointment. And sometimes when there is a known language barrier, you'll be scheduled in for more time because the interpretation will actually take more time out of your appointment.Now, when you arrive at the clinic and you see the receptionist, you can remind him or her that you need an interpreter during the appointment. Also, just to be on the safe side, when you see the doctor, you can also let him or her know that you need an interpreter. So it's super important that both the healthcare provider and the patient are able to communicate effectively. So in many healthcare facilities, translation services such as in-person and over-the-phone trained interpreters are available.Tip number 2, arrive 15 minutes in advance of your appointment time to fill out forms. So for your initial meet and greet appointment with the physician, so the first time you go to the clinic, you'll be asked to fill out new patient intake forms. So one of these forms is the patient medical history form. And I've actually made a video about how to fill it out, so feel free to check that out as well.And tip number 3 is to have your health information prepared beforehand. So this makes filling out the patient forms and communicating with your doctor so much easier. So this can include writing a list of what you want to discuss with the doctor, so what your current concerns are. And if you have multiple concerns, you can prioritize your concerns and then discuss them with the doctor in that order so that you can make sure that these concerns will be addressed during your appointment.You can also make a list of questions you have for the doctor, and as well as the medications, supplements, and vitamins that you're currently taking. So you can write down their names, their dosages, how many you take per day, and how long you've been taking them. And also you can make a list of your medical history. So for example, that could include relevant family history as well.So this way you have all of your information prepared beforehand so that you won't be stressed out about having to write all this info down on the spot when you're actually at the clinic. Also, some patient history forms are like this, so that you can freely write your information, and if you're prepared, it won't be as difficult to fill out this blank sheet.Also, by writing everything down beforehand, you don't forget anything. So it really just makes the entire process easier for yourself and for your healthcare provider. So for example, I've had patients who bring with them this printed document that's several pages long, and it lists out everything about their healthcare, and they just print out that document and give it to all of their healthcare providers. Tip number 4.Prepare answers to questions that the provider will likely ask. So when healthcare professionals inquire about your concerns, some examples of questions they may ask include, what can I help you with today? So what is your main concern today? So basically, the provider is asking you why you are here today. In other words, what is your reason for seeking care? Where are you experiencing this concern? So for example, where are you experiencing this pain?Can you please further describe your symptoms? For example, if you say that you're coughing, the provider may ask, is it a dry cough or is there a phlegm? What makes it worse? What makes it better? For example, what makes your leg pain worse? What makes it better? And I've also made this video on questions healthcare professionals commonly ask. And my channel has many videos on words you can use to describe pain and other symptoms. So make sure to check those out as well.It's a really good idea to have the answers to these questions prepared so that you can better communicate your concerns to your healthcare provider, and your provider can then better understand what your concerns actually are. 好了，那今天就到这里了，谢谢观看，我希望这个视频对大家有帮助。好吧，那我们下次再见，拜。